Zyncof is a combination medication used to relieve coughs caused by the common cold, bronchitis, and other breathing illnesses. It contains guaifenesin, which thins and loosens mucus in the airways, clearing congestion and making breathing easier. It also contains dextromethorphan, which acts on a part of the brain to reduce the urge to cough. If you are self-treating with this medication, it is important to read the package instructions carefully before you start using this product to be sure it is right for you. Cough and cold products have not been shown to be safe or effective in children younger than 6 years. Do not use this product to treat cold symptoms in children younger than 6 years unless specifically directed by the doctor. Some products are not recommended for use in children younger than 12 years. Ask your doctor or pharmacist for more details about using your product safely. These products do not cure or shorten the length of the common cold and may cause serious side effects. To decrease the risk for serious side effects, carefully follow all dosage directions. Do not use this product to make a child sleepy. Do not give other cough and cold medication that might contain the same or similar ingredients. Ask the doctor or pharmacist about other ways to relieve cough and cold symptoms such as drinking enough fluids, using a humidifier, or saline nose drop/spray. When taking Zyncof, it's important to follow the directions from your doctor or pharmacist. You can take it with or without food, and be sure to drink plenty of fluids to help break up mucus and clear congestion. The dosage will depend on your age, medical condition, and how you respond to the treatment. It's important not to increase your dose or take it more often than directed. If you're using the liquid form, be sure to measure the dose carefully using a special measuring device/spoon. Don't use a household spoon, as it may not give you the correct dose. For the powder packets, empty the entire contents onto your tongue and swallow without chewing. If you're taking the capsule form, swallow the whole capsule. It's important to note that improper use of Zyncof may result in serious harm, such as brain damage, seizure, or even death. So, be sure not to increase your dose, take it more often, or use it for a longer time than directed. If your cough returns or is accompanied by a persistent headache, fever, severe sore throat, rash, or if it lasts or gets worse after 7 days, be sure to inform your doctor. These could be signs of a serious medical problem, and you should seek medical help right away if you think you may have a serious issue. If you experience dizziness, drowsiness, nausea, or vomiting while taking Zyncof, it's important to let your doctor or pharmacist know. Your doctor has determined that the benefits of this medication outweigh the potential side effects for you. Serious allergic reactions to Zyncof are rare, but if you experience symptoms such as rash, swelling, severe dizziness, or trouble breathing, seek medical help immediately. Remember, this is not a complete list of possible side effects, so if you notice anything else unusual, talk to your doctor or pharmacist. As for the best time to take Zyncof and the recommended dosage, it's important to follow your doctor's instructions for your specific condition. Before taking Zyncof, it's important to talk to your doctor or pharmacist if you have any allergies to Guaifenesin or Dextromethorphan, or if you have any other allergies. This medication may contain inactive ingredients that could cause allergic reactions or other issues, so it's important to discuss this with your pharmacist for more details. Also, make sure to inform your doctor or pharmacist about your medical history, especially if you have breathing problems, cough with blood or large amounts of mucus, or liver problems. It's important to note that Zyncof may cause dizziness or drowsiness, and using alcohol or marijuana could intensify these effects. It's best to avoid activities that require alertness until you can do them safely, and limit alcoholic beverages. If you're using marijuana, it's important to talk to your doctor. For those using the liquid forms of this medication, it's important to be cautious if you have diabetes, liver disease, or any other condition that requires you to limit or avoid sugar and alcohol. If the liquid forms or powder packets of this medication contain aspartame, it's important to consult your doctor or pharmacist if you have phenylketonuria or any other condition that requires you to restrict aspartame intake. Before having surgery, it's important to inform your doctor or dentist about all the products you use, including prescription drugs, non-prescription drugs, and herbal products. If you're pregnant, it's important to discuss the risks and benefits of using this medication with your doctor, as it should only be used when clearly needed. It's also important to consult your doctor before using Zyncof if you are breastfeeding, as it is unknown if Guaifenesin or Dextromethorphan passes into breast milk. It's important to be aware of potential drug interactions with Zyncof, as they can change how the medication works and increase the risk of serious side effects. Make sure to keep a list of all the products you use and share it with your doctor and pharmacist. It's also crucial not to start, stop, or change the dosage of any medicines without your doctor's approval. Taking certain MAO inhibitors with Zyncof may cause a serious, possibly fatal drug interaction. It's important to avoid taking specific medications during treatment with Zyncof, and most MAO inhibitors should not be taken for 2 weeks before starting this medication. Be sure to ask your doctor when to start or stop taking this medication to avoid any complications. Another product that may interact with Zyncof is rolapitant. Guaifenesin and Dextromethorphan are found in both prescription and non-prescription products, so it's essential to check the labels of all your medications to ensure you're not taking more than one product containing these ingredients. Additionally, Guaifenesin may interfere with certain lab tests, potentially causing false results. It's important to inform lab personnel and all your doctors that you use this drug to avoid any issues with test accuracy. If you or someone else has taken too much Zyncof and is experiencing severe symptoms like passing out or difficulty breathing, it's important to seek immediate medical attention. In the U.S., you can call the Poison Control Center at 1-800-222-1222, while Canadian residents can reach out to their provincial poison control center. Symptoms of an overdose may include extreme drowsiness, blurred vision, confusion, hallucinations, slow or shallow breathing, and seizures. Always take the recommended dosage of Zyncof and never exceed it. It is important to follow your doctor's instructions when taking Zyncof and not share it with others. Make sure to attend all medical and lab appointments as advised. If you forget to take a dose of Zyncof, take it as soon as you remember. If it's almost time for your next dose, just skip the missed one. Take your next dose at the usual time. Do not take 2 doses at once to make up for the missed one. When it comes to storing Zyncof, it's important to keep it at room temperature and away from light and moisture. Avoid storing it in the bathroom and make sure not to freeze the liquid forms of this medication. Different brands of Zyncof may have different storage needs, so be sure to check the product package for specific instructions or ask your pharmacist for guidance. It's also crucial to keep all medications out of reach of children and pets. When it comes to getting rid of Zyncof, make sure not to flush it down the toilet or pour it into a drain unless specifically instructed to do so. Instead, properly discard the product when it is expired or no longer needed. You can consult your pharmacist or local waste disposal company for the best way to dispose of Zyncof. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.